So you go and you started losing your hair when you were on your 20s or 19? And did you do you have any older brothers? You're the oldest. How about your dad? So you knew it was coming. Oh shit. Okay. How many of you guys are in the family? How many brothers and sisters you have? Okay. Four of you guys. And how about your brothers right now? Do they still have full plenty of hair? Are they doing treatments? They don't care. Oh, okay, okay. Okay. Does he know that you're doing this? Yeah. What made you decide to get SMP like right now? Since you've been dealing with it since you were 19. You tried finasteride. Yeah. Well, you're a candidate for both. So like the best thing that you did is to give this a try first, and then if you want to do the transplant, you can. Oh, really? Yeah. So that also defeats the purpose of getting a transplant. You do have like really fine hair, like I wanna offer you the injections so you can try it out. The dutasteride injections, and then you stop taking finasteride every month. You just come in once a month. Instead of taking it every day, your medication, you come in once a month. Yeah, for the injections. Yeah. Mm-hmm. And but that's more efficient because it's like right there. It goes directly to to your follicles. Mm-hmm. What do you mean? No, no, yeah, it's not as systematic. Yeah, it's not as systematic as like the medication. Yeah, because it doesn't like the injections doesn't have the side effects as the finasteride or the dutasteride in a pill. Like you won't experience none of that like low libido and all that stuff. None of that. Hmm. Yeah, I do that. I just do it for the patients that do transplant. Yeah, once a month. Yeah. So typically that it's 500 a session, but I can look out for you, bro. I'll give you a better deal. Yeah, it's kind of like PRP. Yeah, but I do like combo packages for like 350 a session. I can look up for you, bro. Don't worry. I need to right now I'm running low, so I need to get somewhere. No, you can switch if you want. Like I would try for 6 months to see how the to see if we see any results, and then from there you can go back to your medication. Mm-hmm. Or the test track. Yeah, that would be something that you wanna. I said, don't worry, I got you. I'll look out for you. I have to see the cost and all that stuff. You've been a client of mine for so many years now. I'm gonna look out for you, trust me. What I would do now, bro, is to change from finasteride to dutasteride orally. The efficiency is stronger. The side effects it could, but you know that it's not everybody that tends to get these side effects. So give me a little bit of your timeline. Like what were you doing when you started losing your hair? Like you were in high school, college, really? Oh yeah, okay. Yeah, yeah, yeah. Is that your girlfriend, your wife? God, you guys been together since high school. Yeah. Dude, you had a lot of hair. I remember. Mm-hmm. 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 And that's now. Wow. You never go back to that style, that hairstyle? No, I say if you had the opportunity to do a transplant. Mm-hmm. No, that's good. That looks good. Is your wife like a really good support about your hair? Oh yeah, you were thinning right there, bro. You already lost your yeah. You lost your receding right there, receding hairline. Okay. Wow. Mm-hmm. Doesn't look as bad. Yeah. And you start cutting your hair shorter. Yeah. Were you still taking medications? That's your baby? Oh, oh, it's gone though. You started taking medications late, right? When did you realize that it was like a wake up call to do your medications? Oh, okay. It was just reversed. Yeah. Yeah. Wow. Here's what I think about. I think that people make it seem a lot more outrageous when it comes to the side effects than anything, and they just scared other people. And like you said, it's reversed. I mean, if you experience low libido, if you experience like your heart rate and stuff beeping fast because of taking minoxidil, you just stop taking it and change the form. Topical is like the most safest way, but it's less efficient comparing to. Can you send me those photos? Yeah, yeah. Because this is what we could do. If I'm able to get the that's right injections, yeah, we will do like I'm pretty much gonna charge you how much I pay for the medication essentially, and we could just do and see if it works in your case. Reason why I'm saying that is because of the fact that like you've already lost most of it, so we might not be able to get full results comparing like if you were to start a lot sooner than now. Okay, okay. And then you notice the results right there. Yeah. Mm-hmm. Yeah. And now, yeah. So basically, you started about last year, 2025. You said, right? Okay. Hair club, Bosley, at the men's spot right there in Burlington. Dermatologist, trichologist. Mm-hmm. What did she recommend? Natural pills or medication? What was the difference from the supplements that she sent you versus Nutrafol? What she said? Okay. Mm-hmm. Mm-hmm. Yeah. Yeah. It's close. It's closing. The best way to find out your hair loss is through a biopsy. But because of the fact that you have the male pattern baldness, from far away you could say that it's a male pattern baldness, which is androgenic alopecia, due to the fact that your dad is bald, due to the fact that your brothers are thinning, your grandparents. So for your case, some doctors wouldn't recommend you getting a biopsy. Because getting a biopsy is essentially taking hair off of your scalp and leaving a scar. So that you don't want to do that. If you were to have something odd, like an odd type of alopecia, then yeah, it's recommended to do that because the lab will definitely tell you exactly what you have. If it's either an autoimmune or if it's either, you know what I mean? So then from there, there's more labs and there's more testing that you need to do to figure out the issue of your loss. But for your case, like it's because it's so common, most doctors won't recommend to go that route. Hmm. Yeah, exactly. Hmm. Mm-mm. No. Another good thing that you could do, or that you should have done, was to get your blood work done to check your deficiency levels on vitamins, and then from there you supplement yourself. But that's not gonna fix the issue if you're having androgenic alopecia. What's really gonna do the best way to prevent it or to treat it is to do the dutasteride or finasteride with minoxidil. And I would always recommend the pill better. But there's some people that get side effects with minoxidil, and some people get side effects with finasteride. But it's not, the side effects won't scar you for life. It would just be temporary until it's out of your system. Why SMP considered the last resource is because of the fact that you tried everything and you're going more towards cosmetic. Does this solve the issue? It does not, but it'll conceal the issue. Does a hair transplant solve the issue? Oh yeah, it will, because it will put hair back in, but it won't tell you how far back are you gonna keep losing your hair, because that's something that's gonna be, you can still lose hair in your 30s and 40s, but not as rapidly as during your 20s. Unless if you were to be on medications that actually causes hair loss, that side effects of the medication or that you're taking from something else causes that. Aging cause hair loss, and the reason why is because when you age, density on your hair tend to spread out. Every 10 years, there's a big difference.